Hi. This is likely one of the most difficult videos in my cancer journey that I'm going to share with you. I came outside because it's a beautiful day and I can use the fresh air to help calm me as I talk about this in the sunshine. So I have two things to say before I actually begin. One is, in my last video, I inaccurately said I had a horizontal scar. I don't. I have a vertical scar. Don't think that really matters much to any of you, but it is a 10-inch vertical scar. Runs right down the center of my abdomen and goes right down around my belly button. The second thing I want to say is, even though this is a really difficult video about my first chemo treatment, it does get better. It got better for me. And I at least want you to hear that. So I was coming off just 5 weeks of a big surgery when I started my chemotherapy. I was not healed from my surgery. I was still sick, very sick. And bless my doctor, when I always have a meeting with him before I go up to the infusion. And he gave me a hug. He's just fabulous. Anyway, they tell you ahead of time that sometimes people have an allergic reaction to one of the drugs. It doesn't happen often, but it does happen. They give you a little bell off to the side, so if you don't feel good, you press that bell and the nurses stop what they're doing and they come to help you. So there's a lot of drugs they give you about an hour's worth prior to the chemo drug to help prevent reactions. And then they start titrating the chemo drug slowly. So it was my paclitaxel that they were starting. And within about, a minute, I didn't feel good. Now, my nurse had 2 other patients in the quad that she was helping, and she turned around from one patient and went to walk to the other and glanced at me, and I said, "I don't think I feel good." That's the last thing I remember for 5 minutes. I had a severe allergic reaction to the drug. I was unaware of anything for 5 full minutes. I remember as I slowly came to, I was yelling, my back hurts, my back hurts. Well, it was my mid-lower back that was spasming. I remember I wasn't awake yet. My eyes were not open yet. I was just hollering. I remember that they felt my kidney areas on my back to make sure it wasn't my kidneys that was in pain. And it wasn't. And then at some point I opened my eyes. There were 4 nurses and a doctor around me. I could have died and not known it. I had no idea when they came, what they were doing. One male nurse was directly in front of me, and he looked me right in the eye and he said, "I want you to breathe with me. In through your nose and out through your mouth, slowly." Now at this point, I was hyperventilating and I was still in pain. And I had no idea what was going on. I was just coming into awareness. It was scary. And I thought to myself, I can't do that. I can't breathe. I can't breathe. And he kept saying to me, "Do it with me." I did the first breath with him. Didn't help. I thought, this ain't working. And he said, "Do it again." And he didn't take his eyes from me. And I did it again. And then I felt like I was coming awake. And then slowly over the next 5 minutes, I recognized I had a cannula in my nose. The oxygen tank was there. I had a blood pressure cuff on. I had the finger probe on where they measure oxygen rate and pulse rate. I was completely unaware prior to that of anything. And I remember the nurse saying, looking at the doctor and saying, are we ready for the Benadryl? However many cc's it was. And the doctor paused for a moment and then said, yes. Well, that part of the reaction then finished. The panic, the anxiety that it caused me, it was horrible. It was scary. I looked over at my husband, who was standing to the side, just watching. And later I asked my husband, Tom, were you scared? What was going through your mind? Were you afraid I wasn't going to make it? And he had an interesting response. He said, no, I knew you were going to make it. This is a well-rehearsed team. Every one of them standing around you knew their role. And I knew they were doing what they needed to help you. But his concern was if I couldn't take the Taxol because I was allergic to it, that I would die from this ovarian cancer. I hate that I put him through that. It's still hard. This is such a hard video to make. Well, it turns out that if they give you high enough doses of steroids and some other drugs and Benadryl and whatever else, that they can prevent an adverse reaction from the Taxol. So they let me rest for about an hour, which I think I just slept fitlessly. And then they very slowly started titrating the Taxol again. And I was able to tolerate it. So I can take the Taxol, and that is what's fighting my cancer, one of the drugs that is. Following chemo, I had a side effect that not everyone has. And God bless those of us that have to go through it, because it's horrible. Some people call it bone pain because they don't know what else to call it. I knew it wasn't bone pain because I've had bone pain. I have had 2 total knee replacements. And prior to both of those, I know what bone pain is. And it's debilitating, it's horrible. But this pain was worse. This pain was different. I didn't know how to describe it. Turns out that it's nerve pain. And it is different, and it feels different than bone pain. For 2 days, I felt like I had little bots moving around my body, causing severe, horrible, tremendous pain. 1 minute it would be in my shins. The next few seconds it would be in my knees. Then it would shoot up to my jawline. Then in my wrists. Then back to my knees. I spent a lot of time in my knees and lower legs. I've come to find out that this pain often radiates most in former surgical sites. Both of my knees have been replaced, so those were big surgical sites. It was debilitating. And of course, it was my first treatment. I had no idea if I was going to continue this each time. What I will tell you is that sitting on the couch and crying and telling my husband, I can't do this 5 more times. I cannot do it. It was my first realization in understanding why people might choose not to continue their treatment. And that was very frightening for me. I'm not a suicidal person. I'm not depressed. I love life. And I usually have a pretty positive attitude about it. But the excruciating, relentless pain that I felt for 2 days, I truly didn't know what I was going to do to not have that pain again, because I didn't think I could do it 5 more times. And I had 6 infusions total scheduled. I was filled with anxiety, panicking. I still wasn't feeling good. And I didn't know what I was going to do. It was completely overwhelming for me. Now, getting through that, then I had a talk with my husband and said, look, you are my caretaker right now. And if I am in that excruciating pain, I need you to call the doctor, which is what we should have done. I wasn't in my right mind thinking of how to help myself at that point. I was just in a state of pain and panic. And my husband recognized that he probably should have called the doctor for some pain medicine or to discuss this, but it was afterwards. You know, we didn't know this at the time. We just weren't thinking about it. For 2 weeks, I was in a panic and I was scared about going in for my next treatment, which was 3 weeks. And then I had a blessing come to me. I met with the pain doctor. We call him the pain doctor. What a name. But he is. When we went in to meet with him, I thought, okay, we've got 15 minutes. I'll try to get through whatever I can. The second he walked in the door, I started bawling. I mean, hysterically crying. All my emotions just came out. And I realized the sun's probably too bright. Just a sec, I'm turning a bit. So I started crying. And I said to him, let me get this off my chest, because I can't discuss anything else. If I don't get this out. And I talked about the adverse reaction and the pain that I had felt in my legs and my body. And he listened and he said, your first chemo treatment was traumatizing to you twice. What you are feeling is legitimate. And let's do something about that so you don't have that pain and that anxiety when you go in the following week for infusion again. He spent 2 hours with me. He listened. He offered suggestions. We talked about options. And although I was still sick in the next treatment, it was not as bad as my first treatment. So I'm going to take a minute, and excuse me while I get something to drink. My mouth from chemo is very dry. By the way, I'm drinking a Diet Coke. For the first 2 months, I didn't touch any soda. Now I find that if I have a soda late morning or early afternoon, it kicks in the caffeine a little, and it just helps me feel better for the rest of the afternoon. I'm not quite so tired. So my doctor, the pain doctor, then talked about a couple of things, and I want to throw them out here. I mean, I'm being open with what I'm taking, but secondly, it might help you prepare for a discussion with your doctor. So the first thing we talked about was my mood, because I was anxious, I was scared, I was having my little panic episodes. I couldn't stop them, I couldn't control them. It was overwhelming, and it was inhibiting my ability to rest and recover. So he suggested starting me on Lexapro. And I didn't really want to take a mood stabilizer, but at the same time, I needed something. And his thought process is, Let's get you through now and the next 6 months or the next year. You don't have to take anything long term, but let's do what we can to help you now. The Lexapro, within a week of starting, I was stabilized emotionally. It doesn't mean that I don't have concerns, that I don't worry about my future. Of course I do, but it's a controlled thought process. It has been amazing how well this drug works for me right now, and I'm thankful for having it. The other thing he did was he encouraged that I take Tylenol and diclofenac. I think y'all know what Tylenol is. Diclofenac is like an RX ibuprofen. And I just took those, offset each other for a week. The Tylenol does help with just aches. I have not found that the diclofenac does anything for me, so I don't take it anymore. One huge change to my second treatment was that doctor started me on gabapentin, and I only take it for a week. And that helps with that horrible nerve pain. I still have residual nerve pain. I can feel it kind of like in the background, but the Tylenol takes care of it, and the gabapentin keeps it from being worse. Those things help me tremendously. Now, he also gave me a prescription for Dilaudid, a controlled pain pill. I didn't use it during the second round, because it was controlled well enough with the Tylenol. But it's there if I need it. So, I guess what I want to say right now is we have different reactions to different medicines. When you are being treated for cancer, there's different medicines you take depending on the type of cancer, and depending on the stage, there's different doses. We all have different symptoms, but if you find the right oncology team, they can help you. You have to be open and upfront about what your symptoms are. Don't be afraid to discuss them, no matter how minute the details. Some of what I am experiencing as side effects is different than what my pain doctor normally sees. But he's not given up on me. He is racking his brain to come up with the best options so I feel better following my treatments. And it's working. It's working. So don't give up. Stay positive. Keep people around you that are praying for you, that are rooting for you. When you have good moments, celebrate life and realize there is light at the end of this tunnel. I don't know what my final results are going to be. My son tells me, "Mom, you believe this cancer's gone until you're told differently." That's what I'm choosing to believe, because worrying about it between now and then isn't going to change it. But it does change how I view each day. The first infusion and follow-up was tough, extremely difficult for me physically and emotionally. And I wasn't able to talk about it for a long time because it was so overwhelming. But I'm healing, and I'm doing better, and I got past that first treatment. And I wish all of you well. Thanks for watching.